When staff can't quickly find the supplies that they need, we end up with delayed patient care, frustrated staff, hoarding and over-ordering of items, which adds cost to our system, as well as interruptions to the workflow when materials handlers have to answer the phone to take special orders.
Like most hospitals, we used to replenish our nursing supplies using the PAR system. With the PAR system, each item will have a set PAR level based on historical usage. The material handler would need to count how many of each item that was left, enter that amount into the system, and deliver exactly enough of that item to bring it back up to par. In reality, with every supply room housing over 200 separate items on average, a material handler would do a quick visual scan to see what was running low, and those are the items that get restocked. A seasoned material handler could be very effective with this method thanks to years of experience. For a new employee, however, this process has a lengthy learning curve. Once a material handler scans the items and enters the quantity which is actually left, he goes down to the storeroom on the first floor and downloads his handheld. The system automatically prints a pick ticket with the items needed to replenish the unit. He then pulls the stock from the storeroom shelves and delivers it to the units.
At St. Clair Hospital, we set out to find a stable, reliable way of replenishing nursing supplies. We know from Toyota or lean principles that we want to pull what we need from upstream whenever possible. So we began experimenting with different kinds of Kanban systems or signals that would let nursing staff easily signal to materials exactly when an item is low and needs to be replenished. The trigger that helped us get on the right track was a New York Times article about how Seattle Children's Hospital had converted their nursing supplies to a 2-bin system using lean principles and had great results. After a site visit where the staff at Seattle Children's generously shared their experience, we decided to follow suit and develop our own 2-bin system. We recognized that the work of switching over all our supplies to this pull system would take a significant investment of time, and so with the support of our CFO, Rick Chesnos, a longtime advocate of Kanban systems, and Director of Materials Management, Dan Pice, we hired an industrial engineer to help our materials supervisor build the new system. Together, they converted 28 different supply areas in 21 units in just 10 months.
Every unit requires extensive backstage planning, and about 70% of that time is spent preparing and analyzing data. First, we looked at usage history and through a series of calculations and statistical analyses established new stocking numbers. Second, we determined size and space requirements. For example, calculating what size bin is most appropriate for toothpaste versus 4x4 gauze pads. One major challenge presented was assessing the physical layout of each unit stockroom, as most varied significantly. We created floor plans for each unit. One thing we learned from this project is that fixed cabinetry is an enemy of lean. Plant operations often provided extensive facility changes, removing cabinetry and unused sinks that were taking up valuable real estate. By carefully reviewing the data and planning the layout from floor to ceiling, we were often able to add previously non-stocked items to nursing units. The next step was to physically build the carts, load the bins in the right location, and label them. Once complete, the carts were delivered to the target supply room and existing stock was transferred to the new bins. Visual cues were provided to instruct nurses of the new system. If you pull the last item out of the bin, simply place the empty bin on the top shelf and pull the remaining full bin forward, and you're done.
The 2-bin replenishment system is now much easier. Instead of counting every item that needs to be replenished, all the material handler needs to do is scan the cart code, then scan each of the empty bins on the top shelf and enter 0 for the amount of each one. The count is 100% accurate every time and requires only a few seconds per empty bin. When the material handler delivers the exact amount needed to replenish the bin, he simply places the full bin behind the front bin, thus guaranteeing first in, first out, and virtually eliminating the chances of having expired items. Usage can be monitored and fast or slow-moving products can be increased, reduced, or removed as needed before they expire.
The nursing staff was asked to start using the new system and provide feedback. Through this process, we fine-tuned the system, to each unit's specific desires for stock placement. If a nurse cannot find a particular product, a cross-reference chart is provided to quickly find its location.
On 6C, we have been very fortunate through the years. Dawn has always stocked us very well. Now we use the two-bin system, like it. We never seem to really run out of anything, so it's a good system.
There was a bit of a learning curve, relearning where everything was located, but since it's been implemented, we do not run out of things. There are much less times that we're frustrated having to wait for things from materials management. Things are here at our fingertips. We can get to them quickly in those emergent situations, and even the non-emergent situations. It just helps your flow of care, less frustration for everyone, and so it's been a good implementation here in the intensive care unit.
Before the ICU was converted from their PAR system, they were calling down for urgently needed supplies several times a day. In 1 month alone, the ICU sent down 73 handwritten requisition forms. As soon as the two-bin system was installed, the number of manual requisitions dropped to 0.
The best thing about it is my budget, my variance report, and my budget on supplies every month has been under budget since we put this in place. And that's a good thing for me. So then I don't have to go into explaining why I use too many supplies, because we don't.
When Bob and Will first came to me with the presentation for the two-bin system, I was totally against it. And I think I maybe even made them cry because I just didn't want it to happen. But now I'm here to tell you that it is truly one of the best systems we have ever implemented in this hospital. There is never a question that supplies are going to be available to the nurses. They are consistently in the same space. And I have not had one complaint from a nurse or a CNA, anyone, since this has been implemented. We have never had a shortage. And so I can now apologize to Will and Bob and say that I was wrong, but it is truly a wonderful system and I'm an advocate for it.